think what patients have to realize with chronic pain or fibromyalgia in specifics is when they have multiple joints that are painful or multiple areas of their body that are painful or tissue that is extremely sensitive to touch or being worked on, that's a warning sign that the inflammation in their body is high and it's being caused by something. So most fibro patients would associate being a fibro patient by having chronic pain in multiple areas. That's what typically defines a fibromyalgia patient, which doesn't necessarily mean they have a structural problem in their knee or their hip or their shoulder or their back or their neck, because it'd be very difficult to hurt all of these body parts at the same time without having some other source of their inflammation. So with a fibromyalgia patient, that's where you try to find out what is the cause of their inflammation, what could be causing that inflammation, where is it coming from. I think with fibro, one of the biggest complaints or complaints to a doctor is pain. But it's not pain in one area, it's pain in multiple areas, which typically doesn't have a specific source that caused that pain. And that's where a practitioner or even the patient needs to be looking at what could be the potential cause of their inflammation and pain. Fibro patients are some of the most complicated and have the most challenges in life because daily activities become extremely challenging for them. They have problems moving, climbing stairs, getting in and out of the car, doing daily activities, exercising to make themselves better. These patients have pain for no reason. It migrates from their knee to their shoulder to their headache. It makes no physiological structural sense. So a fibro patient would typically display with multiple symptoms: pain, anxiety, depression, digestive problems are all hallmark for a fibromyalgia patient. They've seen multiple practitioners, their general practitioner, the specialist, the endocrinologist, and they get referred to me and are typically very happy to hear that there's a number of potential reasons why they've been experiencing the problems they have for so many years. Fibromyalgia is so hard to treat because these patients have to incorporate multiple healing aspects into their program to get better. It won't be just one single thing they can do to improve their condition. Typically, they have to do a number of different things correctly to get better. Detoxify, use herbs to kill pathogens, change their diet, improve deficiencies, improve exercise. All of these aspects have to be done concurrently to see improvement with these patients. I think one of the most common causes of fibromyalgia is toxicity. I think mercury toxicity plays a huge role in a number of patients with fibromyalgia. I think that certain infections can be more than involved with these patients as well. I think viral infections, fungal infections are very predominant with these patients. I think that food sensitivities also play a large role. A lot of these patients may have gluten sensitivities or other food sensitivities causing inflammation in their body. Patients that think they have fibromyalgia think they have something that's causing chronic pain. They would have no idea that that could be potentially caused by an infection or a toxin that is actually creating that pain, and then thinking they need a product that is anti-inflammatory or can remove pain when really they need a product that can kill a virus or kill a fungus or remove mercury. So I think in the US people have so many problems today and haven't been diagnosed correctly. They have multiple conditions. They're frustrated with their practitioner or can't see their practitioner, so they look online, they look on Facebook and associate with patients that have these similar symptoms, which then let them believe they have chronic fatigue or fibromyalgia, but don't understand as well enough that the problem could be from an infection, could be from a toxin, could be from a food sensitivity, and so are not treating themselves correctly or finding the right ways to treat themselves. It only pacifies symptoms. It does not correct the root cause of their problems. These patients will come in with multiple medications, have seen multiple practitioners, have yet to solve their problem. They've merely been putting band-aids on their problem and not correcting anything. I have typically found that most of their problem starts in the gut, and this is what I try to emphasize to them: as 80% of their immune system is in their gut. Most of the inflammation in their body starts in their gut. If you address toxicity, infections in the gut, you will have a significant improvement and reduction of inflammation in their body. I think that I'm effective at treating these people because I've treated so many before, and I've had failures and successes to make me understand that each patient is different, that by incorporating multiple aspects into my treatment, it makes me much more effective by, and using fantastic herbs to kill pathogens and using great detoxifying binding products and changing their diet. So I think that fibromyalgia patients need to be exploring multiple avenues to make themselves better and looking at different ways and different aspects of how to treat themselves. Holistic methods are extremely effective at treating these patients, and I say that from a dietary standpoint or a detoxification standpoint or using herbs to help correct their problem. It's hard to diagnose because there's no one single cause of their problem. This is not what medicine can see in a blood test. This is not something that can be treated with one product. I recommend to my patients fantastic herbs like FX Vital to help calm the immune system down, kill pathogens, kill fungus, kill viruses. I think magnesium is another great product for fibro patients. Somewhat exercise and vitamin D. I think that vitamin D is another excellent product for fibro patients. FX Vital is a broad spectrum herbal product that can kill numerous pathogens. It can affect numerous systems in the body and detoxify a number of heavy metals, chemicals, pesticides, all in one product. That's very rare to see in today's selection of products that we have, and it makes it very easy and compliant for the patient to follow those instructions. FX Vital would help your chronic pain or fibromyalgia. 3 of the ingredients in FX Vital are anti-inflammatory. The ginger, turmeric, Japanese knotweed all have strong anti-inflammatory effects that would help calm down some of the inflammation. So there's 3 herbs in particular in FX Vital that are very anti-inflammatory. Turmeric is an excellent herb used for tens of thousands of years in India to reduce inflammation. Japanese knotweed also has high levels of resveratrol that are very effective in reducing inflammation and cellular inflammation. Ginger also is a fantastic anti-inflammatory that can also dramatically reduce inflammation. Recovery times can be as short as 2 weeks. Recovery times could be as long as 2 years. It just depends on the severity of the patient and how many problems they have and how committed they are.